is Dr. Tracy Zhang with our first patient scenario. This one will be an example of what we'd like you to be doing when you go through the following practice scenarios. We want to determine whether to use epinephrine or not. Epinephrine with our local anesthetic is often used to vasoconstrict blood vessels to make the local anesthetic last longer. Our patient scenario is a 15-year-old female patient who is healthy and takes no regular medications but does have exercise-induced asthma. The question is, can you use epinephrine with the local anesthesia for this patient? And why or why not? But we do need to have a little bit of background in addition to what the case tells you. What does exercise-induced asthma mean? You need to be sure you ask the patient, how often do they have exercise-induced asthma? Has it been 10 years, 5 years, last month, last week, every day? There's a great deal of variability with this, and that may change some of your treatment options in dental hygiene. For this patient, she does carry an albuterol rescue inhaler, as they call it, because she's had quite a few episodes of exercise-induced asthma in gym class this year. With that in mind, one would definitely want to restrict the use of epinephrine for this patient. Do you remember why? Epinephrine has a preservative in it called sodium bisulfite. Many asthmatic patients are allergic to sodium bisulfite and compounds like it. Because of that, they might have an allergic reaction because of the epinephrine preservative in the local anesthetic. Now remember, they're not allergic to local anesthetic, and they're not allergic to epinephrine. We all produce epinephrine with the fight or flight response in our bodies. But remember to discuss in greater detail with your patient when they have asthma, what happens, and whether they have their inhaler with them. For this particular 15-year-old girl, we would use a local anesthetic that lasts longer than the typical xylocaine because you should not use epinephrine. This is Dr. Tracy Zhang, signing off.